At this time, I'd like to ask the town board and our town attorney if we wanted to vacate our seats for right now and mingle within the audience there as we prepare for a presentation. So maybe we want to vacate our seats. I wanted to introduce CJ Urlaub, who's with St. Mary's Hospital, he's president, and Catholic Health SVP, Senior Vice President, Strategic Partnership, Integration and Care Delivery in Niagara County, and certainly, again, no stranger to the town of Newfane. Carolyn Moore is with him today. So we're going to turn it right over to you and give us some information as to some exciting news coming into Niagara County. So without further ado, we'll give him a nice warm welcome and we'll have you take it.
Well, thank you, John. I really appreciate it. We've got some exciting projects that are going on, and so we wanted to have the opportunity to share with you a little information. And so thank you for taking the time tonight to join us. Before I get started, let me share with you, I've not had a chance to meet all of you. I did get to meet a few people up at the all-time, what did you call it, After Dark?
Park After Dark.
Yes, I had a lot of fun. My horse did not win though. But
Mine did.
yours
Oh,
did.
sorry.
But let me tell you a little bit about myself. I'm originally from Rochester, New York. Went to school at Rensselaer Polytech in Albany. Worked in healthcare in Rochester for about 8 years. Then had the wonderful opportunity to come to Buffalo. I worked at Buffalo General and then Kaleida for 15 years. Then went off to Pennsylvania and we did a turnaround in Scranton, Pennsylvania. That went so well. My bosses, it was a big national healthcare company. They had hospitals in Ohio, both in Youngstown and in Springfield, Ohio, that we did some turnarounds there. I raised our family in Buffalo, always loved Western New York. So we had the opportunity to come back. I got a chance with Catholic Health to lead Mercy Hospital for about 13, 14 years. Around that time, now this is 2018, 2019, Mark Sullivan was promoted to be the CEO for Catholic Health. Mark started a refresh of the strategic plan. And remember, when I was at Mercy, I'm all focused from Mercy down to the Pennsylvania line. He drummed it into me. He said, "You're looking in the wrong direction. Niagara County is the place that's going to be important for us in our future. There's a need up there. We've got a service on one side, but it's a big county." So I took the opportunity and the challenge to come up, work at Mount St. Mary's, but with the intent to try to help Catholic Health and Mark Sullivan figure out the best way to respond to the healthcare needs in Niagara County. So you got like 18, 19. Well, what happened with the pandemic? That happened in 20. So just before that, I'm up here, I'm getting a sense, I'm trying to understand the community. And having worked at Buffalo General and Kaleida, of course, I always pay attention to my old friends, but not my competitors, and learned that they had worked through some opportunity. They explored trying to do something with Eastern Niagara up in this area. They were not able to come up with a solution, walked away, pandemic hits, Eastern Niagara ends up closing Newfane, going into bankruptcy. They cannot survive through the pandemic. I think there was a time where they might have been able to, but not after the pandemic hit. So I went back to Mark Sullivan. I said, "Hey, I know this is not in our strategic plan, but you told me to concentrate on Niagara County. And this whole area is going to be without healthcare, without a hospital." And in my office, Carolyn sees me in my office. I have a huge map of the county. You all know it because you probably grew up here. But for me, I'm as far west as you can go. I mean, I'm right next to the Lewiston-Queenston Bridge. This is a huge county. It takes me an hour to get from my office all the way up to the other corner. So recognizing that this whole community, and Lockport's like right in the middle of the county, was not going to have a hospital. Mark Sullivan said, we've got to figure out a way to address the need in that community. But we also recognized at the same time that Eastern Niagara, most of the hospitals in Western New York are under an old model. Eastern Niagara was built 100 years ago. Mount St. Mary's was built 100 years ago. That's when people would stay in hospitals for a long, long time, and all surgery would be done in the hospitals. It's not that way any longer. So there is, even though the folks at Eastern Niagara did absolutely the best they could to try to keep that hospital open, and especially the staff and the physicians, it's not sustainable given the model that they had. So we started going out, exploring how could we address the needs of the community without going bankrupt and be able to be sustainable for more than a few years. So we learned about this concept called a neighborhood hospital. But before I get into the slides, and I'm really excited to show you the progress, and admittedly, if you go by on Transit Road, you're not going to see it. It's in an apple orchard behind Home Depot, but I've got some great slides. I want to show you the progress. And then after we're done with that, I'll take some questions. I know there's at least one or two elephants in the room with the announcement that happened last week, so I'd be more than happy to try to address some of those things. But I want to show you a video first, and I think it's the right way to start things off.
There's a great sense of community, neighbors helping each other, working together. Important location in Western New York, so
when I think about people living in this community, having to drive to a different county, 40, 50, 60 minutes away in order to receive care, that isn't right.
There was an unmet need in Niagara County for over 80,000. And Catholic Health stepped up, much like we did 170 years. City of when the dogs took care of it. We're not just building a hospital, we're building a continuum. Listening to local officials, EMS providers, State Department of Health, and the executive branch, anyone who had a say in the how care is delivered, how we build an innovative solution.
We've been providing healthcare for the same way for a long time. This is an opportunity to really start to take it to that next level.
Our building has been out on East Avenue since 1908 when they opened. This new facility not only will bring a new concept to healthcare, but also be refreshing.
That's what I'm most excited about, the creativity and the innovation and the current state-of-the-art healthcare provision and services to that community.
So we began to explore different micro hospitals that are in existence across the country. And in some areas, they're called neighborhood hospitals. These hospitals have a full-service emergency room, a smaller number of inpatient beds. They also provide imaging, lab, and pharmacy services.
I am most excited about the increased number of treatment rooms. The design of the rooms really gives us flexibility to treat patients as efficiently as possible.
This neighborhood hospital will be built with significant telemedicine capabilities. Each of the rooms will have a TV, video camera, and an audio capability. Specialists from throughout Catholic Health will be able to interface with patients that are on that campus. This is where the future is.
When you're having a stroke and they'll be able to get the care they need as soon as possible. And that's potentially life-saving for some of our patients.
We should be able to provide services within a community so that people have timely access and quality access to care. And I think that Catholic Health is the right organization to do that.
Catholic Health took on such a complicated project because that's what we do. We always put the patient first. The solution for Niagara County is one that's sustainable. It goes beyond healthcare provision. And we know that Lockport will be the anchor for the community, for the health and the wellness.
And what that really could mean. Let me take you on a journey, though. We've got a whole bunch of slides as what it looks like as we try to build this. I'm glad I'm not working.
I know, just right enough. Practiced.
There we go. Okay. Next slide. There we go. So, remember I shared with you, late 19, early 20, just as the pandemic's starting, we're recognizing that Eastern Niagara is not going to be able to survive. We got to come up with another solution. We worked very closely with the Department of Health and the state to try to figure out how do we make this thing work. So there was all sorts of approval processes. We were able to achieve approval in record time because we had the relationship with the state. Then they recognized that this was a necessary service within the community. So November of 2021, you would think, well, what the heck did you do for 2 years? This is absolutely record time to build a new hospital or get even approval. So we were in the Hall's apple farm. Believe me, that day it was extremely muddy. But once we get into the spring, I was shocked actually at how much work has to be done to prepare the site. There were these huge mounds that they had to clear away, flatten everything out. Next slide. You can see right here, there's big pads that were laid down for the facility. Next slide. They then were able to dig the foundations. There is not a basement in this hospital, so we're right on the ground. But they went through and poured all of the footers and the foundations. Next slide. We were able to get the steel up the fall of that year. So within 6 months, we had the area prepped, the pipes and all the electrical, all of that kind of stuff was in, and we were able to get the steel erected. Remember, during a pandemic, when there were supply problems, the fact that we got this steel is close to a miracle because the rest of the country was not getting this. We actually had some connections. Some of you may be in the building trades, but one of the companies in Lockport we utilized to help us with the steel. Next slide. So this is kind of tough to see, but this is the access road. So Transit Road is over here. You come in behind Home Depot. Home Depot is probably right there. You come in behind Home Depot. There was already Scheimer. Scheimer Road was right here. It ended. We now come up here. See this nice turnaround? The town plows are going to turn around here. Okay, they needed a way to get around. They'll come into this point and we got to take care of the rest. It comes up and the hospital's sitting up in here. Next slide. So now that point that we were looking at, still the same direction. The turnaround is down in here. Transit Road goes up here. The apple farm, the apple orchards is still here. There's actually, you can't see it, but there's a pretty good rise from down here, and there's a little creek here. We had to create a way to get over the creek. And the front of the hospital's here. So what we're looking at now is the back of the hospital, and you can see the steel's up, the roof's going on. Next slide. A couple of different other, this shows you that we've got the paving in. Again, that's the entrance from Scheimer, and this I wanted to show you is the entrance from Ruhlman, and we actually worked with we talked to the fire department, make sure that the turns and everything you can get into this location. We don't expect a lot of patients coming in this way, but it's still an access point. I do want to mention, talking to, and I see some of our fire department and EMS partners out there, we listened to the EMS and we are absolutely doing our best to create an entrance for the ambulances off of the bypass. It's called a bypass because they don't want anybody coming on and off the bypass, but we're keeping our fingers crossed. We've worked with a lot of the politicians. The town has been great, DOT, the state, and even we got to get some federal approvals as well. But we hope to be able to allow ambulances to come off of the bypass onto the campus. Next slide.
Sorry.
Whoop.
Sorry.
Am I supposed to speed up?
Yes.
Okay. What I wanted to show you here is the kind of underground services that are going into the 70,000 square foot. It's not just a general office building. It is a hospital, so we've got to hit all of those backup generators and all that kind of stuff. So this is just one of the complicated areas. Loading dock, all that. Next. One of the challenges that we had was the roof. To be able, and so that's why I wanted to show you the roof. Remember, the roof started going on. There were supply issues with getting the materials for the roof. We had to then come up with a way to be able to put the roof down in the middle of the winter. You don't get roofs generally installed in the winter. So we had to do an extra expensive, we could keep going. But that's why I like this. This roof is real expensive. So I wanted to show you that. Next slide. This gives you a look. We were able to do the asphalt. That's the base coat down there now. So if you go onto the campus right now, there will be a finer coat that's finally put down, but we don't want to wreck it with all of the construction equipment. Next slide. Again, we're trying to do this thing this winter. And so we've got the roof on, and you got to put the fireproofing in there on all of the beams, but it's freezing inside. So we ended up, we thought we could do it with a couple of heaters. That didn't work. We had to bring in a lot more heating to get us through the winter with the way we were advancing the roof. The roof, normally you'd have the roof all done, then you heat. We couldn't do that. We couldn't take the time. So, you know, we've got a partially completed roof. Snow, there was one storm, there was a huge drift inside the building. So that's been a challenge to us. But then you can start to see some of the piping has already been put in. Some of the wall joists are going up. Next slide. Again, you know, trying to get the roof done. Better pictures of some of the other piping that's gone in, the windows. Next slide. And so the cool thing is these wall you know, joists and all that kind of stuff has really taken off. It seemed like there was a period of time where not much was going on inside because they were working on the roof and underground and everything. And now a lot of the wall partitions are going up. You can also see some of the drywall. We had to go with, because we were doing this in the winter and we couldn't regulate easily the humidity. So this is mold resistant drywall and everything we had to put in because we can't wait for it to warm up. Next slide. Where'd our EMS guys go? This picture is for these guys. We talked to the fire departments and the ambulance crews. They pleaded with us to get a covered overhang so that when the ambulance pulls up, they can be, and the patients can be protected from the weather. Underneath here, we're going to have heated pads and everything so that it will be, we won't have snow in there. And then the way we can get in, you can get 2 ambulances in here. And then if a third one ends up coming in, we have a disaster or something like that, the ambulances can come up here, or if they park 2 here, you can get around. So we did that. This is what the EMS people told us we needed to design it like. Next slide. You can see this one basically is showing the weatherproofing and all that are put on the outside. Next slide. And then this gives you kind of a sense as to how this thing is all starting to come together. Again, back over here is the roundabout, and you come up into the hospital. The front entrance is right here. The inpatient area is up in front here. So we've got 10 beds. We got the capability of putting in another 10 beds, if that makes sense. Behind it, this whole area here is the ER. Imaging is in here, pharmacy, laboratory, and then this part here, this is what makes this the neighborhood hospital. This whole part is a physician office building. Mount St. Mary's has the privilege, because we're so close to the border, we have a lot of specialists. Lockport, Newfane, you don't have a lot of specialists, believe me. So we have been recruiting folks, specialists for this space. There's 30 spots. This is a huge physician office building. Next slide. All right, so I wanted to spend a little bit more time sharing with you. Let me catch up here. Oh, I forgot. Can you go back one slide? Right back here. We looked at a lot of places throughout the community. This location was chosen rather than being on Transit Road. There's a couple of spots right next to, we were really excited about this, right next to where the Express Care and the Niagara ASC is. There's a building there. We were talking with the developer there. We wanted to put the hospital there. We couldn't get a helicopter out. We can get them in. They would have buzzed right over the house or the professional office buildings back there, but they couldn't take off and get out. So right here is a helipad. So we worked with Mercy Flight. We'll be able to get air service right there. So if you can go to thank you. Now, you probably can't see this, but let me share with you a little bit more of the concept of what this hospital is. I have heard disparaging comments that this is a glorified urgent care. This is a full service emergency department. There's no comparison between an urgent care and an ER. This ER has to meet the same standards as Suburban, Mercy, Buffalo General. We have to meet the same requirements. 24/7 physician. Urgent care doesn't have that. Urgent care doesn't do 24/7. Urgent care doesn't stabilize people like this place will. So I want to get that across. You heard Dr. Rogers. Dr. Rogers is UBMD. She was at Eastern Niagara. We have now contracted at Mount St. Mary's. I used to have Team Health, which is what all the rest of the Catholic Health has. We ended up going with UBMD because we wanted to make sure that the care that they were receiving, we heard really great feedback about their care at ENH. We now have that at Mount St. Mary's. It's the same group that's going to be at this new hospital. And you heard how excited she was about the transformative facility that this will have compared to ENH. Totally different. 18 ER rooms, 2 trauma rooms or 2 triage rooms, big rooms. There's a room of size, there's a psych room, and there's a sane room for sexual assault. Wish we didn't have to do that, but it's needed in the community, and we've got a special room for that. I'd mentioned the 10 inpatient beds, telemedicine you heard, state-of-the-art imaging. We are going to have the MRI from Eastern Niagara. We've got a spot to be able to get it in the back of the building there. We're getting a brand new CT scanner, brand new mammography, and a couple of extra other imaging components. We're going to have a pharmacy. We're going to have a laboratory in here. We've invested in cardiac services, so we'll be able to do stress tests. ENH was not able to do stress tests all through the week. We're going to have at least 5 days. I'd like to try to get to 6 days if I can of coverage there. And then I shared with you the specialists and all. We'll also have a community room because this is not just about treating folks when they're ill. It's to try to encourage folks to be healthy. So we're the team already has folks lined up from the county for diabetes education. We want to do some cooking classes. We've got heart failure support groups that are planned. And since it's a Catholic hospital, we're going to have a checkup. Next slide. The other thing that is, and I think that allows us to do this concept called a neighborhood hospital, is the fact that ENH was visionary and they have an express care, but they also have a surgery center on Transit Road. When ENH closes, they're anticipating to close on a Friday. That the following Monday, it will open as Mount St. Mary's urgent care, occupational medicine, and surgical center, outpatient surgical center. So that we didn't need to build that inside the hospital because so much surgery has already shifted to an outpatient basis. At Mount St. Mary's, over 80% of my surgeries that we do in the hospital, could be done at this center. It's all moved to outpatient. So that was a big, huge part of it. Next slide. I think what's important as well is about the staff. Yes, we recognize that there's a health need in the community. But what are all those people gonna do that had jobs at ENH? We saw the requirement, the need, and we wanted to be able to offer those folks jobs. So in effect, and this is important, we are not ENH. We're not Eastern Niagara Hospital. We're not a successor to Eastern Niagara Hospital. They are a totally separate company. They have a separate board. They have a separate administrative team. We have a management agreement with them. But it's limited. The things that we have provided them are IT support. So for example, when their phone system's gone down, it's kind of an older system, our IT department was able to get them back up and running, working with Verizon and another vendor. We also have worked with them for supplies because we purchase a lot. We're $1 billion system. We purchase a lot of supplies. We were able to get them some good supply costs, trying to figure out a way to keep them viable until we could get this hospital open. But the important thing is that we are creating, now I understand they existed before, but they were going to be gone. We're creating about 150 to 200 jobs in Lockport with this hospital by this investment, $70 million investment. So we've done numerous recruiting fairs. ENH was wonderful in allowing us to come in, work with their staff. We did 3 on-site full-day recruiting fairs and met some wonderful people. We're really excited that they're going to be able to join our team. Next slide. And so I want to show you again what it should look like at the end. You may have seen a little bit in the video, but here again, orient you. Here's the front of the front entrance of the hospital. You got the little high-rise thing there. This is the physician office, and then over here is the inpatient area. Next slide. I'll show you the ER. So where I was pointing over on this end, that's now over here. This is the inpatient area. And this is the whole emergency department, and the ambulances are around the back corner here with the overhang. Inside, we've taken some design cues from this region, and I think it's absolutely going to be beautiful. We're using, again, we got to rely on technology so this thing is sustainable in the future. So it will have kiosks for registration. There will be people assisting folks if they struggle with the kiosks. And I think it's absolutely going to be beautiful. Next slide. This is the waiting area in the physician office. Next slide. And we're hoping, knock on wood, we don't have any further supply chain issues, which we've run into plenty, that we will be open in the early fall of this year. So a lot is happening. That facility is changing by day. It's pretty impressive. So I think that may be my last slide.
Yep.
Is that good? Okay. So I'd like to open it up to any questions that you might have. And thank you for your attention tonight. Yes.
Hi, I have some questions. My name's Nicole. I'm a resident of Newfane. I'm also a first responder, and I'm also a registered nurse.
Mhm.
So I'm very much interested in the health and welfare of my community. And I'm sure that you've had these questions before, and I'm sure I'm speaking for a lot of people when I ask, what about the gap between June and fall? What happens to my neighbors, potentially myself, my family members who are in need of an ER, and now our ER care is further and further away? Newfane has had its share of losses over the years. We've been treated rather poorly by every hospital system that's come in here. As I think most of you guys could agree. I fought to try and save our hospital that's just down the street. I actually worked at that hospital for some time when Eastern Niagara tried to make it Reflections. And then I watched them take service by service away. And so I'm very wary when I hear people say things like right sizing, because I know what that means. That means a loss of services. So I had a couple of questions that, based on your presentation that I had, I hope that maybe you could answer.
Sure.
First, just to correct one thing, you said that the Newfane Hospital closed in 2000, and like with the pandemic, it was actually before then. To let you know that the pandemic had nothing to do with Newfane Hospital closure. It was all mismanagement by Lockport Hospital and everything that we gave up here. basically, we've consistently hemorrhaged healthcare from our area, including dialysis beds, physical therapy, occupational therapy, pharmacies, and a lot. So the questions I have are, what services will be lost that are available at Lockport now that will not be available at your hospital? As
Do you wanna-
far, and as, you
let me
can even
go-
write them down and then I'll just be quiet if that's okay. 120 jobs that you say that you're creating, I wanted to know how many of those are actually direct care staff and how many are not? Because as a nurse, I'm very much interested in how many people are there to take care of my neighbors. What's your trigger to transfer patients for how many hours that they would be there at your, the inpatient beds? At 60,000 square feet, how much is the hospital? How much is the actual offices that you're making? And basically, what's the difference in the care there? And I just wanted to give a nod to the Catholic slant on this, part of Catholic health and, following Jesus' footsteps and stuff. And to remember that Proverbs tells us that we need to speak up for those who cannot speak for themselves and for the rights of all who are destitute, speak up and judge fairly and defend the rights of the poor and the needy. So what's going to make your hospital successful here when I'm told that my neighbors and myself included are basically underinsured, too much Medicare, and too much Medicaid to make a hospital successful? So those are my questions.
Very good.
Well, you didn't hold anything back. So let me try to address many of those. First, I want to share with you, yes, I run a big organization and run a big hospital and all. I was a very volunteer EMT in a community about this size. May actually been a little bit smaller. I know what it's like to have to do the training, volunteer. We never got paid anything. I would work all night long and then get up the next day and go into do my real job. So I know what you're talking about. And give me a little bit of credit too. My wife is a nurse. I saw her going through nursing school. I could never have graduated nursing school. What she went through. So I have enormous respect for the nurses and what you do for our community.
Teach nursing.
So the services that we're providing versus what Eastern Niagara provides right now. Eastern Niagara has inpatient beds. Their census is about somewhere between 6 and 11. The new hospital is 10. Okay, so no loss of service there. They have an MRI, CT scanner. We will have that. They have a laboratory. We will have that. Same kind of thing too. Remember, you may not realize this, but they have laboratory personnel during the day, but at night, it's point of care testing. Same thing that we're going to have here. I will share with you, we based a lot of what the need is in the community and how it's being cared for to basically look at what Eastern Niagara is now. And we also, remember I was down at Mercy, we have the MAC, Mercy Ambulatory Care Center, that serves a fairly significant population down there. And that, our new hospital's ER is expected to see about 15,000 visits. Eastern Niagara right now sees about 10 or 11,000. The Mercy Ambulatory Care Center says 25,000. So we used a lot of the need analysis and all based upon those kind of bullet points or those data points. In the paper that Eastern Niagara also right now has Reflections, which is the drug treatment, inpatient drug treatment program. That is going to close. They've lost staff. There's requirements for the number of counselors to patients. They can't stay open. We have a 65-bed unit over at Mount St. Mary's, and the Newfane, your old hospital, has been repurposed with quite honestly, a very good inpatient that got detox. So that population, I think, is going to be very well served. I'm trying to think what else. all the stuff that's going on at the South Transit Road Ambulatory Surgery Center, urgent care, it doesn't change. We're doing this, that's successful. We don't have any immediate plans to do any changes there. We think that that's a successful model. And we also think that that's part of the future. I'm trying to think what else they have. I mean, those are basically the services that are currently at Eastern Niagara.
You're saying just reflections, just inpatient substance abuse would be the service that would be lost with this model at your facility?
At our facility, but it's served by both Mount St. Mary's, the Newfane program. I forget, what's the name of the?
Recovery
Recovery.
Center. The Recovery
Recovery.
Center of Niagara.
So that's covered for here, and we're also opening a 40-bed facility at St. Joe's. So Mount St. Mary's serves a huge portion of the Erie County population for that population. So we think that, you know, it should work its way out. I don't think there should be a loss of services that way. So that's only your first question.
Yeah, I had a few.
Um,
Sorry.
the direct caregivers, that 120 that I mentioned, you have to realize what we're building here is not a standalone hospital. It's part of a health system where that 120 to 150, I gotta just take a second. I think that number is entirely direct caregivers. You know, Catholic Health has those services already. They have billing and quality and, well, you know, I take that back. I mean, I count environmental service and dietary and all as direct caregivers. I mean, you as a nurse can't serve your patients without those folks there. But that 120, those aren't administrators or billers or anything like that.
Well, if you could get me the numbers, I'd really appreciate it. Just in general, doesn't have to be today, but I can tell you as a nurse who worked through the pandemic,
Yep.
that you do not have a hospital bed without a nurse at the side of it.
Oh,
Period.
yes.
End of discussion. When we talk about that, we cannot relegate our care to the
So if you're,
kitchen staff, right? We
oh,
have to have
certainly.
nurse.
but honest to God, it is, and you know, it takes a team to make that work. The nurse is very, very important, but if the bed's not clean, there's infection risks and all that other stuff. So as far as the nurses are concerned, out of that 120, let me see. Now, remember, the ASC has about 50, and there's another 120 here, or there's 50 there, there's probably 60 or 70 at the hospital. There's about 40 nurses in that number of 70. So really more than half are nurses.
Okay, so I won't keep
For
your
the
time. I
10
know you
beds, so the ER, and the office doesn't actually have a lot of nurses.
I
So
think you may be undershooting your mark, but go ahead. No, it's cool. Need more.
I can tell I'm not gonna convince you, so.
No,
The triggers for transfer, there's only 10 beds. So the intent is that we're providing service to the community. So let me share with you. Eastern Niagara has announced they're closing.
Sure.
They're done. That's your reality. That was going to be your reality. Eastern Niagara would have closed without Catholic Health's help the beginning of 2021. So we're talking 3 months. Catholic Health doesn't want them to close before this is open. This has nothing to do with Catholic Health. We're doing the very best we can in investing $70 million in this community. You mentioned the payer mix and all that. You mentioned, you shared with us, not a prayer, but
it's a proverb.
a proverb. That's exactly why we're here. We're Catholic Health. We're different than the other hospitals. We saw a need, regardless of the payer mix. We're going to be in your community. We've made a commitment to Niagara County. But Shame on us if we built the same thing or tried to do something. Eastern Niagara was unsustainable. It's an old model. You can't do that anymore with the population the size of Niagara County. It's not possible. So this was our solution. We believe that it meets the needs of the community. We're doing our best, and we're doing this because it's the right thing to do. It's the right thing. We can't abandon 80,000 people that are receiving their care. And this community recognizes it. You lost your hospital. That's devastating. What happens now when Lockport loses their hospital? What's going to happen is you're going to have to go to Mount St. Mary's, you're going to have to go to Suburban, you're going to have to go to Kenmore. This is a problem. I won't sugarcoat it. It is a problem that we've got a 3-month gap.
It's a huge problem. People could lose their lives as a result.
But I
And getting
think what has to be
care.
clear is it's a community problem. It is not a problem of the making of Catholic health.
I don't, and
You can't connect the two.
in fact, I don't think I specifically asked what you guys were doing about it. I do recognize that they're two separate hospital systems. I specifically asked about services that you would provide.
Mhm. And I think I answered that for you.
And what the trigger for transfer was. Is it like gonna be like a 48-hour sort of like little things you can handle, or is it just your capacity?
No, we anticipate a length of stay of around 3 days. Admittedly, 10 beds right now is going to be a challenge. But we think as we look to the future, healthcare continues to advance, the length of stay continues to shrink. It would be irresponsible for us to replicate a big hospital. And then what do you do with all those beds when the care starts to transform and starts to change? So the 10 beds, honestly, Eastern Niagara right now, I think today they had a census of 6. So I think is it perfect? No. But we think it's the right number. We'll have to get this thing up and running and do our very, very best at that. So I think I got everything for you. Let me open it up. Yeah.
Sorry.
Yeah, you mentioned that there's gonna be possibly an extra 10 beds.
Yes.
Are those being built with this facility now, or how's that working?
Can you pull up the slide? Go back a couple. I can show you. Okay, right here. Interesting little fact. You can't build an inpatient bed without a window. So there's 10 beds around in here, right next to the emergency department. This area here is all shelled in. It does not have a finished floor, but all we've got to do is put a floor in and the walls up. But the design is already all constructed. Everything's there. We just plug it in and we'll be able to open the 10 beds.
So that's gonna be constructed at the, with the initial construction, then that'll be like you're saying.
Yeah, but what you'll see in here, if when it opens, you'd be able to look through a door and there's, how do I describe it? There's like stone, crushed stone on the floor. We'd have to pour concrete and then put the plumbing in and all that. The reason we haven't put the floor in yet is because we're gonna get used to this space in here with the 10 beds and see, do we have the sinks in the right place? Do we have the controls for the rooms and all of that in the right place? So we didn't want to build the 10 or 20, only use 10 and then realize, oh my goodness, we made a mistake. We're trying to retain our flexibility in here if we want to change the rooms layout a little bit. Hi. You want to let her go first? All right. Hi.
My name's Gina Redden. I participated really forcefully in the fight to save the Newfane Hospital. We struggled for years to enter in a meaningful dialogue with that management system, and they just would not participate. Then I went and met with Kaleida leadership for 6 months and heard lots of promises. They left. So, on behalf of myself and I think town, I would love to welcome you to town and say, thank you very much for building that. Because we've seen people refuse to integrate, we've seen people promise and not deliver anything. And I've been involved in this for many years now, with an insane degree of attention to the detail. And I know that your system did not have to come here. And I can't tell you how grateful I am and how grateful I think most people are. So I'd like to thank you. And then I'd like to ask one question.
Well,
So
you're welcome. And you have the distinction of being the first.
I will not be the last. I can guarantee you that. I think you'll hear things, people in the community, I think frequently have confused what was ENH and what was caused by them and who Catholic Health actually is. And once they understand that difference, I think you'll start to hear a lot more thank yous. I think it's unfortunate if you have to live any period of time with the failures that system created. So, and I think the more time that goes by, you'll start to hear lots of things.
I think I know what we're putting in here is really special. It's so needed.
It's so needed. I just can't tell you.
And
The
you
data,
all know that.
Yeah.
You lost your hospital. We looked at a whole bunch of different locations and everything, and, a valid request or a valid question would be, why not up here? There's really, when you look at the whole county, that Lockport's like right in the middle. And the natural patterns and everything as people go, where do they go shopping? Where do they go to their doctors? But so we're very sensitive to what you all experience. And I gotta say, I got a chance to go through the hospital. It was beautiful. Yeah, no, Newfane. Yeah, we were talking earlier and, it's a great facility.
It always was. Well, we fought desperately hard, but there's no need to revisit that because it's a lot of old ones.
But that's what was gonna happen again for the whole, when you really look at that map I have, it's almost the entire county. Because
Yes, well,
Memorial's over on one side, I'm over on one side, and you gotta go to another county to go to Medina.
oh yeah, no, well, we fed ENH leadership all of that data, how many people there were in the impact zone.
Yeah.
How the management to failure in Newfane would eventually take down Lockport. We also told that to Albany, we also told that to Collider, we told that to everybody who would listen, and everything he said was accurate, but beyond that, moving beyond that, and painful point in everybody's life here, I do have one question.
Yeah.
So there's, the ER can stabilize people, there's no operating room, but you're taking over the ambulatory center. So can the EMT still bring trauma patients to your facility, meaning, so that if they're stabilized, they can still be operated on quickly in Lockport at the ambulatory care?
Well, if you go with a real serious trauma, it's not likely they'd be stabilized and then moved to an ambulatory surgery center. They need to go to a higher level of care. They need to go to a tertiary center. But the important thing is I used to be, the ambulance I was on was a half hour from the city. And, if you took that ride and then you got stuck there, by the time I got home and got to sleep, I lost 4 or 5 hours. So what's critical here is the patients can get stabilized, okay? They may have to be transferred out, but I will tell you, of the patients we anticipate seeing here, only 10% have to get transferred out.
So
90% are going to be cared for in this community and followed up on an outpatient basis with imaging and testing here and the offices if they need a physician.
So are we saying 100% of ambulance runs will be able to present at that?
Yes,
ER?
and actually, if it's a cardiac arrest, they have to go here. You have to go to the closest hospital.
That's great, because we
Now-
also struggle with the small number of ambulances, because we are a volunteer situation out
Right.
here, and if they have to go to Buffalo, that not only is the patient going to Buffalo, but it's an ambulance on the road far from here for longer. So if they can all go there, that's a huge improvement.
The challenge, though, in my experiences down at Mercy, if you have a really, really bad car accident you, you know, you can be stabilized, but then they got to get to ECMs. I mean, that's where all of the trauma surgeons are and all of that. So I'm not saying 100% of the ambulances are coming here and we're going to be able to treat everything.
No,
We can stabilize them, hopefully, stabilize them to the point that they can survive. But these ambulance guys know that, if it's a real bad trauma, they're going to try to get down to ECMC anyways.
Directly.
Yeah, because the ones that would come to Mercy,
So, but let me ask, I
They
think
were-
what I'm trying to get to understand is the impact on our ambulance crews here.
Yeah.
In a town like this. If my elderly mother lives with me, if I have to call the ambulance, they pick her up in Alpin, they take her to Lockport and stabilize her. Then our ambulance comes home, and if she needs to be transferred, is there a contract with another ambulance system? So
Yeah.
the Alpin guys don't have to go back?
we're going to, ENH has a contract with Twin Cities. Twin Cities has been challenged, but now with new ambulances at the fire department in Lockport, that's taken some of the pressure off. So we've begun conversations with Twin City. We'd love to have them give us a proposal. Catholic Health has AMR. So I at Mount St. Mary's already have a contract, and I will share with you, got a great relationship with Mercy. And we're hoping that Mercy Flight would be interested as well. So I can't commit yet to who, I don't have the contract yet, but we will have a contract for the transfer of the hospitals. Now, I will also share with you, there is a challenge in this county with EMS. And it's not the fault of EMS. There aren't enough volunteers to do all the calls. We feel it in Lewiston. We had a fundraiser. One of the guests went down. We waited 45 minutes. Border Patrol got there before the ambulance did. They sent out the tones like 3 or 4 times. We just had a individual construction guy injured on the ice at the site. It took 40 minutes for the ambulance to get there. So we're feeling it too. I mean, I live in the county. God forbid any of us need the help of the ambulances. It is a challenge. I know Jonathan Schultz is trying to work on it. I know David Godfrey's trying to work on it, but it's bigger than what this hospital is going to solve. This will help, but it's bigger.
The doctor mentioned in the video about a stroke. Is it gonna be a stroke center, or how's that gonna work?
What we're hoping to do what we're planning to do is the ambulances will come here. We will have the ability to do the testing, and Catholic Health, as the EMS guys know, we've invested in a lot of technology. We've rolled out something called Pulsera, which allows the ambulance crews, and the Niagara County guys are way ahead of the Erie County guys. Pulsera allows them to connect directly to the ER. And then if they've got a stroke, we're rolling out a new version of Pulsera where they'll be able to talk to the stroke neurologist and the interventional neurosurgeons. So they can actually see the patient. They can look at what the ambulance crews are seeing in the field and can make the decision, once they get to here, we'll do the studies, and then we may have to. Now, again, of all the strokes, 70% can stay in this county. The hospitals can treat those strokes. Now, I'm not saying that this facility is going to treat all those strokes. We've invested a lot
Do you have
over at Mount St. Mary's to do that.
do you have a stroke neurologist that will be there, or is that gonna be at Mount St. Mary's?
The stroke neurologist for the inpatients and all will be at Mount St. Mary's.
Okay,
We will have telemedicine capabilities, so
got it.
it's very possible that a stroke would stay here for a couple days. There was one other thing. And in this facility here, we hope to have a neurologist. So we'll have neurology office. We're trying to hire a cardiologist. We've hired an OBGYN, not in the community right now, not at my hospital, for this hospital. We have 1.5 primary care physicians out on Robinson Road. They'll move over here. We've got a new primary care physician that's going to be joining us. We're going to have surgeons, cardiologists, ENT, nephrology. They will all the specialists will spend time here, but the full-time guys are going to be women's services, cardiology, obviously primary care. I'm missing one, sorry. Yeah.
Okay. How optimistic is that time frame? I mean, that time frame, that 3 months alone is going to be extremely painful for EMS transports within this community. I mean, we've stated it, 4 or 5 hours is not uncommon for us to spend on one call.
Right.
And when we're running about 1,000 calls a year for our department alone, that's a lot of time to be
That's
spending outside of the county and leaving our community without EMS services. We got 2 ambulances out. Like you mentioned, there's going to be a long wait for an ambulance service. So how optimistic is that a 3 to 4 month period for completion and getting this hospital up and running with all its certifications? And is there any way that Catholic Health can do some sort of bridge at the current ENH facility to really help continue to support the community? Again, we appreciate that Catholic Health is coming in and at least giving us something, and I think it's a good option. But what is the interim in there? And then my last question is, right now we have a reciprocity agreement with ENH for we're ALS paramedic level for our narcotics and other supplies that we purchase, and we have not had good luck trying to get in touch with Mount St. Mary's to move that agreement along. So if I could get that information from you to try and make that agreement work sooner than later, because it's kind of been thrown on us at pretty much last minute notice here.
So let me go back here. You guys like to ask these multiple questions. So the first one is how certain am I of the 3 month, of early fall? That is our best guess right now. Every week there seems to be another supply chain problem. Yeah. We are doing some really creative things, working with the Department of Health, the Wadsworth Laboratory and all that, because it is very complicated, way more complicated than I ever imagined to open a new hospital with new services for pharmacy license, laboratory, imaging. But we've all been working with them and they have been great. We're actually also working with the Department of Health, the local guys, but still DOH, not Niagara County. Niagara County, Dan is wonderful. He's all supportive of us. But we've had when you open a new facility, you got to have the engineers say it's safe and everything. We've been working with them already. They've been out to the site. So we're trying to fast track all the approvals. I was going to say I don't anticipate any problems with the approvals, but I'm not going there. I can't promise that. But early fall is our best guess right now. That's all I can say on that.
My fear is that it goes into the first of the year. At that, and then we get into bad weather and it just multiplies.
My fear as well, because we did not anticipate ENH closing before the new hospital's open. Those 120 individuals that I've hired, I need for the new hospital. I have to hire them. I can't say, well, go take the summer off and don't have any benefits. We're going to hire them. We've made commitments to those people. I'm hiring them. That is really expensive.
Yes, thank you for that. Yeah.
But I can't open the new hospital whenever it's open. We got to be ready. So we're going to spend more time training. We've got new computer systems that they got to get used to. And we're really looking for a culture. And some of you are going to hold me to this, but this culture is going to be different than you're used to. We had the opportunity working with SEIU. We've got the union SEIU at both of our sites. We've worked with them and said, we get to choose the right people, the right what do you want to say? I don't know, the right folks that will fit with this culture. We want it to be part of the community. It's neighbors taking care of neighbors. Now, if they aren't the right fit for the new hospital, then they might be the right fit for Mount St. Mary's, or they might be the right fit for Sisters or something. So we're really, really hoping we can speed the 3 months up. We do not want to have this hiatus. It's not in our best interest. It was not our plan. We wish we were not in this situation, because I really believe tonight would have been even more like, holy crap, we've got this new hospital that we're building and isn't this wonderful? And yet we're dealing with how are we going to have emergency services and the care in the community for those 3 months? I don't have a solution on that piece. Your second question?
The second question was more.
Because I have an answer on your third
spec-
question.
No, more specific to.
Oh, I can take care of that. We will talk tonight, and I'll get a call for you tomorrow.
Everybody else is
Yeah.
fine with it.
But what, didn't you have something in the middle there?
If there was a way to bridge that gap.
Oh.
And it doesn't sound like there is.
I've not been able to figure that out yet.
Some kind of lease agreement.
Well, I will share with you, we did look at, and we explored a lot trying to work with ENH, and looked at the ability to utilize that ER. It's not possible. They're in bankruptcy. So there's certain distances you got to keep the organizations. We explored that. We can't run their ER.
That was my main question, to try and bridge that
Yeah.
gap. But
Their EMS captain as well.
Mm-hmm.
Like, why not, right?
Yeah.
From our chief to you.
Yeah.
Basically, to let us know that we will continue to respond to all calls even during this trying period, that we will make the best arrangements to have coverage throughout our community and there are times when our ambulances may be out and about, and that although it sucks, we know we'll get through this, so.
And so thank you for that commitment. And I'll commit to you that at least at Mount St. Mary's, we will do our absolute best to turn those ambulances around. We've put in place some hallway beds. We're challenged too with staffing and all. Just work with us. You can call my office if you have a problem, get to Emily. We've got EMS liaisons. We need to get through this together because I don't have a solution to open this thing up sooner. I can't get it open any faster. All right. Good. Didn't lose your hold.
No, I want to thank on behalf of, you know, cleared a lot of, I'm hopeful that you cleared a lot of, issues relative to this. Appreciate the $70 million investment that hospital system has made to, Niagara County.
And 150 jobs. That's even more important.
Absolutely.
Yeah.
So thank you. I'm sure we'll be in touch,
Yeah.
for any questions, and even so, if anybody, has any questions, I certainly don't mind being the intermediary. You can email the town hall and we can get it to Carolyn or CJ. So again,
And John, as we get a little bit further along, if you or your board council, your board would like a tour, just please reach out to me.
you know, and certainly your availability, you know, we appreciate you coming down. I know we've been working on this for over a month, and how kind of appropriate it is now that there's been some things happening in the last couple of days.
And I wish we could have done it last week.
But thank you very much, and thank you for coming out.